Hello, class. So, this is just a quick overview of body systems. This is one of the units that we can most connect to us because we have all of these body systems within ourselves. The STAR specifically doesn't test individual body systems. The way that STAR tests you on body systems is how they work together. So, at any given time within our own bodies, multiple body systems are working together for one specific function. So, again, our circulatory system, that is our heart. So, circulatory system, you can just really think of carrying or anything having to do with transport. Respiratory system, you can think of respirar, right? So, cuando respiras, anything having to do with oxygen, your lungs, or carbon dioxide, anything with gas. Circulatory, again, you can connect it to your Spanish. Circula, como se está circulando diferentes cosas en el cuerpo, como la sangre, oxígeno, nutrients, and all of that. The digestive, sistema digestivo. So, again, that is your stomach. A lot of it has to do with nutrients. So, nutrients is one of those keywords that you often see with digestive system. I know I'm going through it pretty quickly, but when I get back, we'll review it. Sorry, guys, that's my baby. The nervous system, so very important to remember about the nervous system, is the brain. So it sends signals and it has to do with the brain. The skeletal system is your bones. So the skeletal system is their protection. And that is where you find bone marrow. The muscular system, you can think of movement, como el sistema muscular te ayuda a moverte. So muscular system and skeletal system often work hand in hand. So again, movement for muscular. One muscle that people forget about is your diaphragm. So your diaphragm is right below your chest. When you take a deep breath, that is a muscle that's helping you breathe. So that's one that you see there. Also the uterus. So for our female students, you are born with a uterus and it is a muscle. One of the questions will come up of the uterus contracting during delivery and so forth. So we'll discuss that one as well. The endocrine system. So endocrine is hormones, very important, and homeostasis. Homeostasis is balance. So you always want to go back to a sense of homeostasis. If your blood pressure is too high, you take medicine to lower it because you want to be balanced. If your blood sugar is too high, you do the same thing. If your iron is too low, you take medicine and bring it up. So again, you always want to go back to homeostasis, which is a sense of balance. Integumentary. So this is probably the longest name for any body system, but that is your skin. So it's a protective barrier, and it helps control body temperature. That's one of the biggest things. So whenever you're too hot, let's say you're working out outside on a very hot day, you begin to sweat because your body is cooling itself off. And again, that sweat happens through the skin. Whenever they mention sweating, it's the skin, which is your integumentary system. The immune system we should be very familiar with. So it's your antibodies and they protect you from infection. As you probably could guess, as I got COVID right before giving birth, my immune system's very weak. So when I get back, right around Thanksgiving, you will probably see me with a lot of vitamins or vitamin C to try to strengthen that immune system. Your reproductive system, again, this is your gamete cells. So for our males, we have sperm, and then for our females, we have eggs. We will go more into detail on the reproductive system and the specific cells a little bit later in the lessons. And excretory, you can think of exit, so removal. Again, it's also helping maintain homeostasis and the buildup of excess fluid. So this is your kidneys, your bladder, urination, and so forth. I will link this in Teams so you'll have access to it there. And you'll use that to help you finish your second independent practice. This is just reviewing the work that you did on Thursday. Friday, you have a new worksheet and you also have an EdSite. EdSite is how I'm getting your grades, so please make sure to complete those. Everyone should have technology at this point. Okay, guys, so looking at this one, whenever you have questions about interactions, I've highlighted very important keywords. So the keywords are what helps you understand what systems you're looking at. So again, hormones, if you remember, we said hormones had to do with your endocrine system. Again, whenever you see hormones, you're trying to go to homeostasis. And ovaries has that keyword of egg. So this is a reproductive system. So again, the action of hormones triggers the ovaries to release an egg. So depending on a female's hormones, that's going to help you. As the female gets older, hormones change and they get through a phase where their ovaries will release an egg later on in life. So again, cytotoxic T cells triggers the destruction of skin cells, which contains viral particles. So again, whenever we think of skin here, the T cells are, you can think of helper T cells as well. That has to do with your immune system. And skin cells, remember, that is our integumentary. Oxygen is absorbed by the lungs and delivered to the pulmonary vein. So you see oxygen there in lungs, so we know for sure that is our respiratory, porque están respirando el oxígeno, right? So that is our respiratory system. And the keyword here is delivered. So whenever there's anything about movement, anything like that happening, that is your circulatory system. Things move around your body via circulation, your veins, and so forth, and that is your heart moving everything around. Excess water is removed from the area, so here we see the word the removal, and return to the bloodstream. So again, whenever we see removal, that is our excretory. You are exiting things. I forgot how to spell excretory. Sorry, guys. Excretory. If you hear snoring, guys, it's just Emilio. He's asleep next to me. So again, the removal is your excretory system. And again, when we're looking at bloodstream, anything having to do with the blood, that is our circulatory system. Monosaccharides, so if you remember, mono means one, saccharides is sugar. So here we're talking and tying back to biomolecules or sugars. So monosaccharides are absorbed through the intestine wall into the blood vessels. So again, our keyword here is blood. We know that is circulatory, and absorption and intestinal. So we know our intestines are a digestive system. And our blood vessels would be our circulatory system. So again, here we're seeing the different functions or jobs of the body systems, but specifically how they work together. For 6, a person begins to breathe heavily because of hormones. So again, breathing would be respiratory. Oh, sorry, guys. And hormones are our endocrine system. Once you remember or learn how to identify those keywords, body systems will be very easy. The lungs draw air past the olfactory cells, which detect smells. So again, our lungs is our respiratory. And detecting or anything having to do with signals will be your nervous system. That is your brain. Tissues surrounding the bladder squeeze and send urine through the urethra. So again, here when we talk about bladder, it is our excretory system. I feel like I spelled that wrong. I'm so sorry. Excretory. So our excretory, you're removing things. Again, surrounding the tissue, the bladder squeezes it to send urine through the urethra. So whenever they talk about anything squeezing or causing contractions, that is your muscular system. This one, to be honest, does not come up a lot. I don't see talk about like the bladder squeezing and so forth. You can also challenge it and say it can be endocrine. They send a hormone that tells you, or it can be the nervous system telling you that, hey, your bladder is full, go and empty it, excretory or exit, whatever is not needed. The major two would be nervous system or muscular system. Contractions in the uterus push the fetus during childbirth. So, again, contractions is a movement. So, this is definitely your muscular system. Your uterus is is something that is a muscle, and a fetus. So again, whenever you're talking about a fetus or anything like that, it would be your reproductive system. A small cut in the skin is closed by platelets in the blood. So again, we're talking about skin, so that tells us it is integumentary. And here we're going around blood, so this would be circulatory. You can just think of, you have a cut, and then the blood flow is taking all those little platelets to the where the cut occurred, so we can block it off and basically like give you some protection. So again, your skin helps out, and then your circulatory system. So interactions between the rib cage and the lungs facilitate breathing. So here, the rib cage would be your skeletal system, and your lungs would be your respiratory. I will put an exemplar with a lot better writing. The brainstem sends a signal, so again, very important, brain and signal, which causes an increase in heart rate. So again, your brain, it would be your nervous system, and your heart rate here would be your circulatory. The muscles raise hairs on the arms and legs to prevent heat loss. So again, here, our muscles is our movement. And preventing heat loss, we're trying to stay in homeostasis. So anything having to do with homeostasis is your endocrine system. Remember, homeostasis and hormones. For these, I'll make sure to put the exemplar as well. The baby's waking up, but I'll try my best to do a separate video for this second half of questions 14 and so forth. If anything, I'll try to write some explanations, but keep on studying, guys. Body systems, again, please make sure to complete the Ed Side assignment. That's where I get your grades, and it'll also be the unit exam. If you have any questions, please reach out on Teams, and then I'll make sure to do our exemplar for section 2. Have a great day, guys.